So hi, I'm back with another video. Today we will cover the physiology and the anatomy portion. So let's get started. I'll share the screen with you guys. So we stopped at this. Now let's move on to this part. Let's move to the neuron action potential. Where's my pencil? Okay. Your resting membrane potential is for the nerve is minus 70 here. This is your resting membrane potential. For your resting membrane potential, who's responsible? At your resting membrane potential, your membrane is more permeable to potassium than sodium at rest. Voltage-gated sodium and potassium channels are closed just like this. Okay. And at membrane depolarization, what is depolarization? Depolarization is basically a spark of an action potential coming. So sodium activation gate opens, sodium rush in like a crowd rushing in. So one thing that you will remember is sodium rushes in like a crowd and it basically produces an upheaval like this, an action potential, and potassium channels are more responsible for resetting that action potential, like bringing it back to the flat, and they are more important for resetting it back to the resting membrane potential. अब इसमें आपने दो वैल्यू याद रखनी है, एक -75 और एक +40. So membrane depolarization हो गई, sodium activation gates are opening and sodium flows inward like point number 2 here. Sodium is flowing inside, potassium is still closed. Membrane repolarization, what is repolarization? Again, it is resetting. Depolarization was, the easy word for it was spark. Got it? So membrane repolarization, sodium activation, inactivation gate closes. Okay, right here. At peak potential, thus stopping sodium inflow, and potassium activation gate opens and resultantly potassium flows outward. We are right here. उसके नतीजे में क्या हो रहा है कि आपकी membrane reset हो रही है. Membrane hyperpolarization, potassium activation gates are although very slow to close, and excess potassium efflux right here happens, and brief period of hyperpolarization occur. The voltage gated sodium channels switch back to resting state. Sodium potassium pump restores your ion concentration. Easiest words, pump is like an usher. Okay, it basically stabilizes your membrane. Let me see if I have any other notes here regarding this. Oh, in my book we didn't have this thing. So yeah, two values, -75 is your resting membrane potential, +40 is your action potential. The goal is that the inside of the membrane has to be negative and the out is positive. So when an action potential arrives, sodium channels open, this positive charge rushes inside, depleting this resting state and making it positive, introducing a spark, a depolarization, and then the sodium channels close, and this positive charge, which was first negative, now became positive and this became negative, will revert back once the potassium channel open. Potassium bahir jayega and the inside of the membrane will again become negative and you will reach -75. So ये आपका आ रहा है resting membrane potential, membrane rest पे है, minus पे है, negative है, and ये आपकी मेम्ब्रेन सोडियम चैनल खुलने की वजह से +40 को रीच कर रहा है, ठीक है. And now potassium channels are opening up, potassium sodium channels are closing, and you are resetting the membrane and it's coming to -70 again. Got it? And I think that's enough. Now I have to add notes. So इसके लिए पहले एक rule set कर लेते हैं. The rule is, ये चार्ट बहुत important है, please. I've seen it coming in my NBMEs and I think I got a question from it. Okay, all of these are large myelinated fibers. Got it? Point number 2 is all adapt fast, all adapt quickly, except 2. Rule of exception याद रखेंगे. Except what? Merkel and Ruffini corpuscle. Merkel disc and Ruffini corpuscle. Okay, for free nerve endings, the book has given a very good mnemonic. A delta plane is fast, but a tech C is slow. So, A delta fibers are fast, myelinated fibers. C fibers are slow and unmyelinated. Location kya hai? All the tissues except your cartilage and eye lens, and they're very numerous in your skin. And what do they sense? Your P and T, your pain and temperature. Okay, now moving on to Meissner's corpuscle. You can have the mnemonic in mind. I miss her fine touch. Got it? So ये तो हमने असूल बना लिया था कि ये large होंगे, सब myelinated fibers होंगे, all will adapt quickly. अब ये कहाँ है? In your glabrous hairless skin. What is your hairless skin? It could be your lips, it could be your fingertips, where there's no hair. Okay, so fingertips. You will keep this mnemonic in your mind. I miss her fine touch. So dynamic fine light touch, low frequency vibration and skin indentation. इतनी ज़्यादा बारीकी notice करता है कि अगर skin भी indent हुई है तो Meissner corpuscles will let you know. Pacinian corpuscles, we have the mnemonic. We'll keep onion skin in mind because they are packed like that. And then this mnemonic, packed in pressure. Pack in pressure. Pack in pressure or pack in deep pressure. So again, these are large myelinated fibers as we had written it down. They all adapt quickly except what? Ruffini and Merkel. And they are found in the deep skin layers since they pack in deep pressure. That was our mnemonic. So they are in the deep skin layers, your ligaments, your joints, and what do they deal with? High frequency vibration and deep pressure or pressure. Now Merkel's disc. What do we have for Merkel? Okay, Miss Merkel is an important government person who works under so many superficial people. You have to keep this little story in your mind. Let me write here. इधर लिख दूं. Miss Merkel, हम क्यों इस पे इतनी मेहनत करें? क्योंकि ये इम्पोर्टेंट है. Miss Merkel is an important government person who works under, उस बेचारी का कसूर नहीं है, who works under so many superficial people. So many. I'm sorry, the writing is so gross, but I'm a doctor. So many superficial people. So large myelinated fiber, exception क्या है? Adapt slowly. Where is it found? in your superficial skin. So we have used this mnemonic, superficial people, superficial skin, and in your fingertips. Miss Merkel is an important government who works under many superficial people. So she is under a lot of pressure. Under a lot of pressure. P for pressure. So pressure, deep static touch, for example, helps you feel the shapes and edges. Now moving on to Ruffini corpuscles. Ruffini was the name of a guitar brand. So Ruffini guitar strings stretch under the fingertips at different points or angles. Okay. इसका लिखते हैं इधर कहीं Ruffini guitar strings. Stupid mnemonics help you keep things in your mind. Stretch under fingertips. Fingertips at different joint angles. At different joint angles. Now this mnemonic will help us keep Ruffini corpuscle in mind. Ruffini is, remember, a guitar brand. So Ruffini के गिटार के string हमारे fingertips के stretch के अंदर bend करते हैं at different joint angles. So let's read the mnemonic together. Large myelinated fiber intertwined among collagen fiber bundles and they adapt slowly. ये rule exception ये थी ना हमारी. And they're found at your fingertips and even at joints. And what do? They stretch and change the joint angle. Please take a screenshot of this if you think you cannot write it on your book, but I suggest you write these mnemonics on your book. As I have written, let me show you my book. You can see it. Okay, let's move on to the next part. Peripheral nerve. Acha, first of all, a bundle of axon will establish a bundle of axons is called, what does the axon do? It takes the information from the cell body away from the cell body, right? That's what we established last time. So a bundle of axon is called funiculus. Funiculus, you need to know these terms, funiculus. And a bundle of funiculus, like a lot of axon bundles are called, a bundle of funiculus is called nerve fasciculus. Got it? And what is your blood? Here it's mentioned blood nerve permeability barrier. We'll talk a bit about it. Blood nerve permeability barrier. क्या है आपका? It lies between your peripheral nerves, axons and blood stream. और इसके बारे में, this thing, an important fact is that it is most difficult to cross by what? By the drugs. So अब हम बाकी part is very simple. Endo means inner, peri means around, epi means outer. So endoneurium, this structure right here, is a thin supportive connective tissue that ensheaths and support your individual myelinated. एक nerve के around जो covering होगी, that is called your endoneurium. And your endoneurium is affected in what disease? Your GBS disease, Guillain-Barré syndrome. What is perineurium? When this axon bundle or nerve bundle, which is basically called a funiculus, you have a bundle of funiculus which forms fasciculus. Fasciculus के ये पूरे fasciculus के इर्द गिर्द जो covering है, that is your perineurium, and this is where your blood nerve permeability barrier is formed. So your book has given the mnemonic P for perineurium, P for the permeability barrier, and that is the point where it is most difficult to cross by the drugs. What is epineurium? अब जो आपके ये nerve bundles हैं, इन पे तो चढ़ी हुई है what? The perineurium. Okay, each of them, but together with blood vessels and these nerve bundles, what covers them? The epineurium. So epineurium, then the perineurium, और बीच में एक एक nerve के around would be your endoneurium. So that's the right order if you go out. Endoneurium, perineurium, and epineurium. Chromatolysis. Chromatolysis है क्या? It's a process where you repair the damaged axon. पीछे हमने एक word पढ़ा था gliosis. Gliosis is basically repair, but all brain repair is not always good repair. Okay, so let's read it together. Reaction of the neuronal cell body to axonal injury. सेल बॉडी का रिएक्शन है, ये आपकी सेल बॉडी पड़ी हुई है, इसका रिएक्शन है टू द एक्सोनल इंजरी. ठीक है, चेंजेस रिफ्लेक्ट प्रोटीन सिंथेसिस इन एफर्ट टू रिपेयर द डैमेज्ड एक्सॉन. इंक्रीज्ड प्रोटीन सिंथेसिस होता है टू डू व्हाट? टू रिपेयर दिस डैमेज्ड एक्सॉन, व्हिच इज कैरेक्टराइज्ड बाय, अब विल सी द चेंजेस. Change number 1 is round cellular swelling. You will see round cellular swelling. ये आपकी cell body के अंदर अगर आप देखो तो it has become round and is swollen up. Displacement of the nucleus to periphery. ये nucleus आपका periphery की तरफ आ गया. ठीक है. And dispersion of the nissl substance through the cytoplasm. ये जो dots हैं, nissl substance, RER वाले, dispersion of the nissl substance. This process is termed as chromatolysis. We covered one part, chromatolysis. Now we'll talk about Wallerian degeneration, जो axon के level पे हो रही है. You'll learn the level that is distal. Disintegration of the axon, and ये axon है, and the myelin sheath distal to the site of the damage. ये site of damage है. This injury was proximal and this injury is distal to the site of the axonal injury with macrophages removing the debris. Distal आप देख रहे हो, your microglia are your macrophages, which I have written as M0. वो क्या कर रहे हैं? इसको साफ कर रहे हैं. They are removing the debris. And proximal to the injury, what you see that the axon retracts. Axon खुद को retract कर रहा है, इकट्ठा कर रहा है, and the cell body sprouts new protrusions. ये देखो, ये vegetation protrusions दे रही है, कितनी ज्यादा, that grow towards other neurons for potential re-innervation. कि भाई उसने इस axon को तो delete मारा और इस ये वाली पीछे हट गई कि भाई मेरा अब तुमसे कोई ताल्लुक नहीं है, पीछे को जा रही है, और यहाँ से उसने ताल्लुक बनाने शुरू कर दिए कि भाई मुझे बचा लो. The cell body sprouts new protrusions that grow towards other neurons for potential re-innervation, and it serves as a preparation for axonal regeneration and functional recovery. Okay, now this part, neurotransmitter changes with disease, is also important. It comes up in your MCQs. And thankfully this is empty and we have to fill it up as we go. So your acetylcholine is concerned with movement. Its location of synthesis is basal nucleus of Maynard, which is present in your forebrain. Or what does happen to it in anxiety, depression, schizophrenia? Nothing. कुछ भी नहीं होता है इसको, acetylcholine को, but it decreases in your Alzheimer's disease. That is why you give acetylcholine, reuptake inhibitors are given in Alzheimer's disease. And since the thalamus nuclei is damaged in Huntington disease, तो इधर भी आपका जो है acetylcholine would be decreased, and Parkinson disease where your acetylcholine is increased. ठीक है. Now moving on to Alzheimer disease. No, Huntington disease where you have your thalamus nuclear damage, which is called date nucleus. Thalamus nuclear damaged. Okay, you'll remember these three: decreases in Alzheimer and Huntington and increases in Parkinson. What about dopamine? Dopamine location of synthesis is ventral tegmentum, which is in the midbrain, and your what's your SNC? I think that's your substantia nigra. Not sure. They should have written it somewhere. I'm not very good with the acronyms. So your SNC is basically your substantia nigra. Yeah, I'm right. This is in your midbrain. So your dopamine is in your midbrain. And what does dopamine do? Precise movement के साथ concerned होता है ये, and mood plus mood. And what happens to it in anxiety? Nothing. In depression, dopamine is decreased. In schizophrenia and Huntington disease, it's increased your dopamine, and it is decreased in your Parkinson disease. और probably इसी वजह से आपको schizophrenia के अंदर hallucinations हो रही होती हैं and psychosis हो रहा होता है. Okay. Now moving on to GABA. GABA has an excitatory action, and location of production is nucleus accumbens, which is in the basal ganglia. ठीक है. This is decreased in anxiety, has nothing to do in others except that it is also decreased in Huntington disease. तो बाकी हमारे boxes खाली है. Norepinephrine is concerned with your fight or flight response and is produced in the locus ceruleus, which is in your pons, and it is somehow related to your arousal, your stress. We'll talk about it later. So what happens that your norepinephrine is increased in anxiety, and in depression it is decreased. Okay. Now serotonin. What does serotonin do? It stabilizes your mood, and it's produced in the raphe nucleus in the brainstem, and it's decreased in anxiety. Serotonin is decreased in anxiety, in depression, and in Parkinson disease. Why is this chart important? आप इस chart को देखकर आप medications दोगे, ठीक है? That will help you see the pharmacology part, and sometimes these arrows come as it is in your exam. So let's move on to the next part, your meninges. So these are a set of 3 membranes. Okay, 3 membranes that surround and protect the brain and spinal cord. And where are they derived from? From both the neural crest cell and the mesoderm. Number 1 is your dura mater. This is the thick outer layer which is closest to the skull. तो हमने establish कर लिया पहली जो layer है उसका नाम है dura mater, और ये आपकी bone के साथ, skull के साथ चिपकी हुई है. Let's trace it here. This right here is your dura mater. ठीक है, ये ऊपर skull है. Then is your arachnoid matter. Let me choose a different pen. 2 is your arachnoid matter. This is the middle layer, and it contains नाम से ही पता चल रहा है वेब लाइक कनेक्शन. Arachnoid in a different language comes from, if some of you are interested in Greek mythology, तो उसके अंदर you might have read about arachnoid. Arachnoid is related to spider, so these are web like connections. तो इसके अंदर इस तरह से बनी होती हैं spaces. तो these web like connections की वजह से this is called the arachnoid matter. And here this layer, जिसको मैंने कलर कर दिया येलो, this is your arachnoid matter. Now the third layer, I'll use another color for this. Your pia matter is very thin, fibrous inner layer that firmly adheres to the brain and the spine. अब ये brain को cover कर रही है exactly. So this very thin fine layer is your pia matter, जो थोड़ी सी transparent भी है, ये वाली जो layer है, ठीक है, ये वाली पीछे ये अनकवर किया हुआ है इसको, बीच में ये आपका ब्रेन खुला हुआ पड़ा है. सो CSF कहाँ फ्लो कर रहा है? Just below the arachnoid layer in the subarachnoid space, which is located between, हमने क्या establish किया था? TAP. तो वो कह रहे हैं कि आपकी जो subarachnoid space है, it is right here. ठीक है, your subarachnoid space is between your arachnoid and pia matter. Your epidural space is the potential space between your dura mater and the skull or the vertebral column containing fat and blood vessels. अब let's write skull with green. Skull इधर ऊपर है. Go back. Green. Skull. So ये कह रहे हैं कि epidural space इधर है, dura के ऊपर. This is your potential space between your dura mater and your skull. ठीक है, और इसके अंदर क्या पड़ा हुआ है? Fat and blood vessels. And this is the site of blood collection which is associated with your middle meningeal artery. ठीक है, this is very famous clinical related to this, your middle meningeal artery, and how when a motorcyclist fall on their lateral side, तो इधर उनके टेरियन के ऊपर, टेरियन is this H like point जहाँ पे MM में ट्रेवल करके जा रही होती है, और जब वो रप्चर हो जाती है तो वहां पे फिर हेमरेज हो जाता होता है और हेमाटोमा बन जाता होता है. They are talking about this, that this is the site of blood collection associated with middle meningeal artery injury. So let me not refer to that chemical now. Anyone who's aware of middle meningeal artery? It's a branch of external carotid artery if you follow it back. We'll talk about it later on. Okay, the next thing is blood-brain barrier. Blood-brain barrier prevents the circulating blood substances, for example, bacteria and drugs, from reaching your CSF or CNS, and it is formed by 4 structures. Number 1, tight junctions between the non-fenestrated capillary endothelial cells. Where are your capillary endothelial cells? ये हैं आपके endothelial cells. तो वो कह रहे हैं the tight junctions between them, between these non-fenestrated capillary endothelial cells से बना हुआ है by your basement membrane. ये जो ब्लू में दिखा रहे हैं बेसमेंट मेम्ब्रेन, ये वाली मैं ट्रेस करी उसको बेसमेंट मेम्ब्रेन से. एंड देन योर पेरिसाइट्स, basement membrane pericytes. Pericytes is a new addition in our book. It was formed by 3 structures: the tight junction, the basement membrane, and astrocyte foot processes, but they have added pericytes in your book. And then these are the foot processes of astrocytes. अगर आप blood brain barrier किडनी के लेवल पे जो बैरियर है, और भी जहाँ जहाँ बैरियर है आप उनको देखो तो उनके 3 मेन कॉन्स्टिट्यूएंट्स होते हैं. एक बेसमेंट मेम्ब्रेन पक्की होती है, एक कोई एंडोथेलियल सेल पक्के होते हैं, और एक कोई फूड प्रोसेसेस. उधर पॉडोसाइट्स के फूड प्रोसेसेस थे, इधर यू हैव एस्ट्रोसाइट फूड प्रोसेसेस, बेसमेंट मेम्ब्रेन एंड टाइट जंक्शंस बिटवीन द नॉन, देखिए एक क्राइटेरिया था, एंडोथेलियल सेल जरूर होंगे, एक बेसमेंट मेम्ब्रेन जरूर होगी, और फिर फूड प्रोसेसेस होंगे कुछ स्पेशलाइज्ड सेल के। लेकिन यहाँ पे उन्होंने एक और चीज इंट्रोड्यूस करवा दी, योर पेरिसाइट्स। रिमेंबर द 3 constituents which are required to form a blood barrier, blood and the structure barrier is कि एक बेसमेंट मेम्ब्रेन हो, एंडोथेलियल सेल्स हो, और कोई स्पेशलाइज्ड सेल के फूड प्रोसेसेस हो। And in your brain, these are the endothelial cells के tight junctions, which are non-penetrated capillary endothelial cells, your basement membrane, your pericytes, your astrocyte food processes. Okay, they are saying that your glucose and amino acid cross slowly by carrier-mediated transport mechanism. Your non-polar lipid-soluble substances cross rapidly via diffusion. Okay. Then they are saying that your circumventricular organs with fenestrated capillaries and no blood-brain barrier allow the molecules in the blood to affect brain function. For example, area postrema, vomiting after chemotherapy, OVLT, which is the organum vesculosum lamina terminalis, osmoreceptors or neurosecretory products to enter circulation. For example, neurohypophysis leads to ADH release. Okay, these detect osmoreceptors क्या डिटेक्ट कर रहे होते हैं आपके ब्रेन में? They detect your thirst or high or low temperature, and they respond to osmolarity changes. ठीक है, तो अब ये कह रहे हैं यहाँ पे कि कुछ एरियाज के पास ब्लड ब्रेन बैरियर नहीं है, और ब्लड ब्रेन बैरियर ना होने का क्या फायदा होता है, दैट दे हेल्प यू डिटेक्ट द चेंजेस। फॉर एग्जांपल, एरिया पोस्ट्रीमा फॉरन वॉमिटिंग कराएगा आपको कीमोथेरेपी के बाद, बिकॉज इट हैज नो ब्लड ब्रेन बैरियर। योर ओवीएलटी, ऑर्गेनम वेस्कुलेसम लेमिना टर्मिनालिस, ये आपका, आई थिंक इधर कोई डायग्राम नहीं है, बट योर लेमिना टर्मिनालिस इज आपके ब्रेन के क्रॉस सेक्शन पे इस तरह की जो डक लाइक शेप होती है ना, मैं दिखाऊंगी आगे, लैमिना टर्मिनालिस इज दैट। सो OVLT is organum vesculosum lamina terminalis, which are basically osmoreceptors and the neurosecretory products like your neurohypophysis to enter circulation. Now, blood-brain barrier disruption, for example, in stroke, leads to vasogenic edema. ठीक है, even mannitol can cause, no, mannitol can cause osmotic changes. So vasogenic edema हो जाएगा if this blood brain barrier is disrupted. Hyperosmolar agents, for example, mannitol can disrupt the blood brain barrier. And lead to the permeability of medications. Other notable barriers आपकी बॉडी में कौन कौन से हैं? Blood testis barrier, not important to know here. Maternal fetal blood barrier of the placenta, और रीनल में भी आपका बैरियर है. वॉमिटिंग सेंटर, वॉमिटिंग सेंटर के लिए अब हम एक डायग्राम बनाएंगे. दिस इज योर एरिया postrema, and then we'll read along. We'll write CTZ in bracket. Other things I'll write in black because green is giving me anxiety. Coordinated by your nucleus tractus solitarius in the nucleus tractus solitarius, जो कि 10th cranial nerve का वो center है, in the medulla, आपकी medulla के अंदर, which receives, what is medulla? Medulla was a part of your brain stem, which receives information from the chemoreceptor trigger zone, ये वाला CTZ, which is located within your area postrema, pronounced the puke strema, इन द फोर्थ वेंट्रिकल। अब जब हमने ब्रेन को साइड से देखा था, ये पॉन्स था, मिड ब्रेन उसके ऊपर था, पॉन्स, मेडुला ऑब्लोंगेटा, ये साइड से हम देख रहे हैं, ठीक है। इफ हैव अ पिक्चर, डू वी हैव अ पिक्चर समवेयर? I wish we have a lot. That is why I say कि do the pictures from the PDF, because your book doesn't have many good pictures, and if you don't have good pictures तो आपको बातें समझ में नहीं आएंगी. So this is a good diagram. ये है आपका pons, और ये pons के और cerebellum के दरमियान में आपका है fourth ventricle. ठीक है, ये वाली बात आपको याद रहेगी. And this is your midbrain, and this is your, think, medulla. Yeah. So ये बात इस तरह से कर लेते हैं, midbrain, pons and medulla. ये हम इनको साइड से देख रहे हैं. टेंट शेप्ड, इनके पीछे फोर्थ वेंट्रिकल है, और फिर आपका ऐसे सेरिबेलम पड़ा हुआ है, वैसे जैसे कोई दरख्त होता है, लाइक हैविंग फॉलिया. ओके, लेट्स मूव ऑन, मूव बैक. हाँ, इधर. तो अभी हमने ये एस्टेब्लिश किया कि योर CTZ इज लोकेटेड वेयर, इट इज लोकेटेड इन द मेड्यूला, ये वाला एरिया, इन द मेड्यूला, इन द फोर्थ वेंट्रिकल, इस एरिया के पास. GI ट्रैक्ट वेयर द वेगस नर्व इसको करेगा. हम लिख लेते हैं, GI इन्फो किसके जरिए आ रही है, इसको एरिया पोस्ट्रीमा को थ्रू वेगस. वेस्टिब्यूलर सिस्टम, वेस्टिब्यूलर इन्फो भी आ रही है. वेस्टिब्यूलर इन्फो कहाँ से आ रही है, आपके कान से. और वेस्टिब्यूलर इन्फो कौन सी नर्व लेकर आ रही है, 5, 6, 7, 8, 8th नर्व कान से लेकर आ रही है वेस्टिब्यूलर इन्फो के. घूमते हो जब जोर से तो वॉमिट आती है ना. एंड cranial nerve 10 also brings the gag info from the back of your mouth. ये भी 10th लाती है. GI info भी 10th ला रही है. And then area postrema triggers your nucleus tractus solitarius. Okay. And what does it do? एकदम से आपके मुंह के अंदर सलाइवा इकट्ठा होना शुरू हो जाएगा, सेलिवेशन होगी. ठीक है. एंड रेट्रो पेरिस्टाल्सिस, पेरिस्टाल्सिस होगा, पर भाई जी वो होगा उल्टा. पेरिस्टाल्सिस, पेरिस, आई थिंक पेरिस्टाल्सिस, यस, आई मिस्ड एन एस. पेरिस्टाल्सिस. और क्या हो रहा है, और होगा आपका एपिग्लॉटिस बंद हो जाएगा. क्लोजिंग योर एपिग्लॉटिस, कि भाई वॉमिट करनी है,